Ladies and gentlemen, good morning and greetings from the UAE. Now, prior to modern medicine, more than 5,000 years ago, traditional medicines like Chinese medicine, Ayurveda, were the norm. Many of these have now been recognized by the World Health Organization and local governments as being valuable to the community. The second largest medical system after allopathy is homeopathy, which made its advent in the 1800s in Germany and is a medical form based on using natural substances from plants, minerals, etc., in the form of drops, tablets, and the famous little white sugar pills. The unique aspect of homeopathy is the law of minimum doses, which means that microscopic trace doses of the medicine is used, which helps the body to strengthen its immunity and in many ways overcome the ailment. Now, as regards diabetes, homeopathic medicines are used for lowering blood and urine sugar levels. They are helpful in the treatment of nerve damage. That's neuropathy. They are used, homeopathy is used in the treatment of renal diseases. And most importantly, homeopathy works alongside regular modern medicine. To tell you more about this is the now famous Dr. Harkirat Wilkhoo, who, as anyone who has sat through our webinars knows, that he is the famous doctor who asks the speaker questions. Now, Dr. Wilkhoo, in this instance, is the speaker, and it will be my pleasure to ask him the questions. He has done his homeopathic studies in India and the UK, and in addition, is a lifestyle medicine specialist also from India and the United States, specifically the American Council of Lifestyle Medicine. He has vast experience of dealing with over 65,000 corporate employees in only the last 5 or 6 years. Prior to that, the numbers were even more. And 12,000 school children. These numbers are specific to the UAE. A teacher, he has given over 2,600 talks on various aspects of chronic disease, and is a faculty of the Apollo Hospitals Education Research Foundation, and is also a faculty in the UAE. Outstanding is a good word to use for Dr. Wilkhoo, and he was awarded the Corporate Wellness Professional of the Year in the international category in the year 2019. Dr. Wilkhoo will be talking about the use of homeopathic medicines in diabetes.
Thank you, Professor Kennedy, for your kind introduction. Am I audible clearly?
W, quite clear.
Thank you, sir. Let me share my screen. Yeah, is it visible?
Very visible, Dr. W.
Thank you, sir. Good morning, friends. Thank you all for participating in RAC Hospital's Diabetes Challenge. As you know, RAC Hospital is committed to community health, and for the purpose, we at RAC Hospital conduct various health events to promote the health awareness among the community. You may be aware, we started our RAC Hospital Diabetes Challenge on 24th of September this year. And in connection, we have conducted various webinars on topic related to diabetes. So today we'll be talking about the importance of alternative medicine in diabetes management. So let's start. What is diabetes? You may be hearing for so many times, all webinars, we are talking about the diabetes. In the introduction comes with the diabetes and definition and basic information about it. Diabetes is a chronic metabolic disorder with abnormal insulin function. A simplest definition of this. Diabetes is classified into various types. Type 1, which is known to be insulin dependent. Type 2, where the insulin becomes imbalanced. Third is gestational diabetes, which comes in during the pregnancy. And juvenile. Again, this is a type of insulin dependent, but it happens in the childhood. So in type 1, generally we talk about type 1 and type 2, specifically type 2, because 85% and above diabetic patients suffer from type 2. In type 1, the responsible beta cells of pancreas either do not produce insulin or they produce very less insulin. Whereas in type 2, responsible beta cells work very poor and the insulin production is insufficient and there is an insulin resistance by the cells. That makes the problem worse. Let's understand the insulin mechanism and glucose regulation, how it works, what insulin does. When we eat food, the food is digested to the lowest point, glucose, which is absorbed. And there is a rise in glucose level in the blood. Immediately, the beta cells of pancreas is activated by the brain to release insulin. And insulin take over these glucose molecules to the target cells for utilization. And the unused glucose is stored by the liver as a fat for later use. This overall lowers down the glucose level of the blood. Similarly, when there is a low sugar level in the blood, the brain activates the alpha cells of the pancreas to release glucagon activates conversion of stored fat into glucose and release it in the blood so that there is a balance of glucose. Now, who is at risk and whether the risk is only for certain category or what? The risk may be for developing a new diabetic condition or to complicate an existing diabetes. There may be three categories. We can identify as the three categories. So let's see. First category is non-modifiable, which is not in our control, like family history, your age, your gender, your race. There is no control on this. Then comes the modifiable, which is absolutely in our control, like weight management, obesity, sedentary lifestyle, chronic stress, alcohol, tobacco, and the faulty food. And of course, there is one more category, the medical category. If the patient is suffering from polycystic ovarian disease, or hyperlipidemia, or thyroid problems, or fatty liver, or hypertension, or chronic kidney diseases, their list is long. These people tend to be at more risk for diabetes, either developing a diabetes or getting a complicated comorbid conditions. Now, we talk about various systems and organs that get infected by diabetes. The vital organ which are affected is brain, heart, eyes, kidney, and peripheral vascular system. Now, there are few classical symptoms presented by diabetes, which are identified as frequent urination, increased thirst, increased hunger, frequent urinary tract infections, pruritus, that is itching, and blurred vision, and unexpected or unexplained weight loss. So let's see. There are other symptoms also. The earlier what we spoke were the classical symptoms, which everyone knows. If you Google out, so these symptoms will pop up that diabetic patients have these problems. But there are other symptoms which the patient suffers but are unaware, like brain confusion or a brain fog, which is due to the imbalance of glucose level, resulting in improper brain function. Second, there is a frequent vaginal infections in the female, which is very troublesome, never feeling of being well, itching, burning urine. Similarly, 50% of our diabetic males suffer from erectile dysfunction. Hyperglycemia leads into oxygen-free radicals in the blood, reduced nitric oxide production, resulting in reduced ability to relax the muscles. It's not only for the erectile dysfunction, it disturbs many of the muscular functions. Now, when these glucose level are uncontrolled and left untreated for a long time, it may lead to a fatal conditions like chronic diabetes, damaged nerves, nerve endings, vascular linings, and lead to reduced sensory action, blood supply, and cellular damage. Now, this leads to more fatal conditions. Very common. Many people, those who have high glucose, high sugar level, or uncontrolled sugar level, they might be feeling a tingling or crawling sensation in the lower limbs. This is because of the nerve involvement. Now, this nerve involvement, if not taken care of, or if you are not taking care of your diabetes symptoms, if you are not taking medicine properly, if you are not following the regime of a diabetes management, this may further lead to ulcers, diabetic ulcers, commonly known as diabetic foot. Now, diabetic ulcers are often tend to get bacterial infections and may lead to fatal condition of gangrene, amputation. Gangrene is very dangerous. The fourth, which is very important, in last webinar we were talking about diabetic nephropathy. It's very important. Nephropathy, the diabetic nephropathy is the leading cause of chronic kidney diseases, and it's preventable. Now, if you are a diabetic, what you should be looking at? Look for foamy urine, blurred vision, diabetic retinopathy. If you have extreme fatigue, even if you are looking good, if you feel you are healthy and you are diabetic, but you feel lethargic, weakness, profound weakness, what we say, fatigue, edema of the foot, peripheral vascular disease, hypertension. If you notice any of these signs and symptoms, please consult your physician and inform that you are suffering from these problems. Now we must know our limitations and we must fix a target. What is the main target for a diabetic person? To have a target blood glucose and manage the comorbidities. How can we do it? The best way is to beat. That's the reason the entire webinar series is named as DiaBeat, to beat the diabetes. Be physical active, eat food which is low in calorie and low in glycemic index. Simple meaning, eat a food low carbohydrates and sweet. ABCs, always monitor your hemoglobin, glycated hemoglobin, that is HbA1c, and blood pressure and lipids. Avoid smoking, even if you are using an oral tobacco or you are smoking in any formats. Then watch, track, and treat your signs and symptoms, which you may be feeling that this is not due to diabetes, but let the physician investigate and take it forward. Friends, today our webinar topic is alternative and complementary medicine. There are many formats of medicinal treatments available. Few of them are recognized by WHO. These medicinal treatments are practiced individually or used as to complement the conventional regular treatment. Now, being a specialist in homeopathy system of medicine, I'll be talking about homeopathy. Homeopathy is a holistic medical science founded 200 years back by one of the leading physicians of his time, Dr. Samuel Hahnemann. Homeopathy works on a simple principle, similia similibus curantur, which means like cures like. It uses natural resources. That's the reason it is safe and has no side effects. It acts on individualized with totality of symptoms. According to WHO, homeopathy is the second largest medicinal system of medical treatment worldwide. Few of the medicines I will be talking about, which are very popular in diabetes management, to control the sugar levels, blood sugar levels, to control sugar in the urine, and the comorbid signs and symptoms. The first common medicine is Syzygium jumbolacin. It has anti-hyperglycemic, dyslipidemic, anti-inflammatory, and cardioprotective properties. It acts on increased thirst, increased urination, especially the urine with high specific gravity, and diabetic ulcers. These are the common signs and symptoms which Syzygium works on. Second comes Gymnema sylvester. The gymnemic acid, also popularly known as sugar killer, has anti-diabetic, anti-sweetener, and anti-inflammatory properties. It acts to lower blood glucose by reducing the absorption and reducing the sugar craving. It reduces glucose in the urine. Third important medicine comes Cifalandra. Cifalandra mimics the insulin action and has a property of anti-hyperglycemic. It acts on bilious complaints, boils, carbuncles, especially with the burning ulcers and boils, increased urination, profound weakness, dryness of mouth, and increased thirst. The fourth popular medicine, which is used for the treatment, uranium nitricum. This works for increased urination, increased thirst, with increased hunger. This is a unique thing. Burning urine, incontinence and uncontrollable urine, frequent urination during night, dryness of mouth, and dryness of skin. So like I said, patients are treated with totality of symptoms. These are the symptoms which the specialists find, the homeopath finds to treat the patient. Now there are other medicines which works on the uncommon signs and symptoms which I was talking about like diabetic ulcer, neuropathy, then blurred vision, then itching, vaginal infection, erectile dysfunction. These type of symptoms are there. So Helonius is very popular medicine which acts on the protein present in urine. It reduces the protein in the urine. It works for a chronic kidney disease, reduces the frequency of urinary tract infection and vaginal thrush. Conium. It's a very good medicine for neurasthenia, means profound generalized weakness, especially of lower limbs. Formication is produced because it acts on the nerves. Formication means the tingling of nerves, what you feel, the tingling and crawling sensation in the lower foot. Then comes natrum phos. It acts on digestive disorder, especially with the patients who are diabetic, and improves the glucose absorption and assimilation. Why it is important to absorb and assimilate? Because whatever we eat is turned to a unit of glucose. Glucose is present in the blood. Now, insulin takes this glucose to the target cells. Natrum phos works for assimilation. It reduces the insulin resistance and make it able that the cells can assume it. Then comes Abroma agosta. Wonderful medicine for muscle wasting. You might be seeing many friends, your relatives or patients who are diabetic. Suddenly they start losing weight. They don't know, they are eating well, but they are still losing weight. So Abroma agosta is one of the best medicine in that case. Dryness of mouth, increased appetite, frequent urination. Many people you will find they are diabetic and they are being told to control the calories, but the patient is unable to control his hunger, his or her hunger. They eat more, they increase appetite. Next medicine comes phosphoric acid. It's a wonderful medicine which basically works on nerves, diabetic neuropathy, increased urination, albumin in urine, physical debility, neurasthenia, erectile dysfunction. Then medicine comes phosphorus. The action is basically on the pancreas. It works for tubercular diathesis, means there is a tendency of self-destruction of the cells. Phosphorus works wonderfully on that. And it works on pancreatic cells. It's very useful for neurasthenia and erectile dysfunction. Now, there are other medicines which I've put in the chart. I'll skip this. Now, when we are talking about a diabetic management with any medicine, diabetic management comprises of two basic pillars. One is the medical treatment and second is the lifestyle treatment. These two together combine and make a complete management program. Now we are talking about the diabetic management, so we'll be talking about the diet, which is important for diabetic management. There are various diet formats popular. To name few, like Mediterranean diet, paleo diet, Atkins diet, keto diet, now very popular intermittent fasting. The list is very long. So we can talk about focused topic to the diabetic. Now we require supplements to support the medical treatment and to give a good patient. You know, everyone knows what supplements. Supplements are vitamins and minerals, what we take from food, or we go to the medical pharmacy and get a supplement and we eat. So basically, what supplement is required for a diabetic management? Vitamin E, vitamin B3, B6, B12, and vitamin C. These 5 are very important for diabetic patients. Why? Vitamin E, it's a strong antioxidant, helps in cell repair, prevents cell degeneration. Soybean, sesame seeds, cotton, corn, these are good source for vitamin E. So I'm using only those which Vegetarian, non-vegetarian people both can consume. I'm including both the things. Vitamin B3, it's very important for beta cell function. What is beta cell? Beta cell is the cell present in the pancreas which is responsible for production of the insulin. So B3, vitamin B3 is very important for beta cells. It controls lipids and protein metabolism. Red meat, fish, banana, fortified cereals. These are a good source for vitamin B3. Vitamin B6. It helps for RBC production. Neurotransmission. Regulates serotonin, dopamine, and mood. Now, regulating serotonin and dopamine is very useful. Serotonin suppresses the hunger, whereas dopamine increases the hunger. If you have a balance, then you will be able to fight with diabetes, controlling your calories. Chicken, fish, peanut, soybean, banana are good source for vitamin B6. The common things which you can use easily. Vitamin B12. It helps for RBC production as well as prevent anemia. The organ meat, fish like sardine, tuna, trout, and fortified cereals are good source for vitamin B12. Vitamin C helps in cell growth and cell repair. Basically, in diabetes, it helps to regularize the ion exchange. Orange, strawberry, blackcurrant, broccoli, Brussels sprouts, peppers are good source for vitamin C. Now, the next important supplement comes mineral. There are so many minerals, and body requires many minerals in trace amount. But when we talk about diabetes, we are talking basically for two minerals which are very important, magnesium and chromium. Magnesium helps in metabolism, neurotransmission, works as an anti-inflammatory, and it also regulates the mood. In the previous slide, when I spoke about the serotonin and dopamine, these are also helpful for regulation of the mood, the good hormones, the happy hormones. Magnesium is behind that. Pumpkin seeds, almonds, peanuts, black beans, avocado, kidney beans, yogurt, broccoli, wheat germ. These are some of the things which are rich in magnesium. Next comes chromium. Chromium promotes insulin production and insulin resistance. If you remember in the previous slides, I mentioned the type 2, there are two basic conditions happening in the type 2 diabetes. One, either there is less in production of the insulin, or the insulin is not being accepted by the target cell. There is resistance of insulin. So chromium works for both of them. Egg yolk, nut seeds, liver, mushroom, broccoli, banana are a good source for chromium. High protein diet, lean meat, eggs, seafood, beans are also good for chromium. Now comes to enzymes. In enzymes, when we talk glucokinase, carnitine, biotin, this helps to regulate the insulin production as well as glucose absorption pathway. This is again an important physiology for insulin to reach itself, the pathway. Then comes polyphenols. These are strong antioxidants. When there is strong antioxidant present in the blood, then the utilization of any mineral and vitamins will be good enough to be utilized. All green leafy vegetables and fruits are rich of polyphenols. Then come the enzymes. Other enzymes are leptin, ghrelin, which is very important enzymes to understand, because these are the two enzymes which regulate your hunger. How much you eat whether you can control your hunger, and what is the metabolism going to be. Basically, leptin and ghrelin regulates the fat metabolism, hunger, and energy expenditure. How much energy from the food which you have eaten should be used. Whereas cortisol and neuropeptide regulates the stress, again influences the fat metabolism. Now, if you go through the previous slides, I'm being mentioning stress is one of the strongest point for diabetic management. Because if your stress is good, your hormones released by the brain are good, the system works proper. Okay, we spoke about the supplements, vitamins and minerals we have spoken. So now we'll be talking about the diet. When we talk about the diet and calories, there are three basic rules for diabetic management and diabetic diet. One, you should understand the difference between simple and complex diet. What we generally say simple and complex carbohydrate. In diabetes, avoid the simple carbohydrates like simple sugar. Always use a complex like whole grain, vegetables. Carbohydrate coming from vegetables also is like potato, sweet potato. These are much better than other carbohydrate source. Then you should be knowing about the starchy and non-starchy food. Avoid starchy food. Always go for a non-starchy. Nevertheless, when we talk about so many things, so there are some food which are considered as superfoods, and superfood should not never be forgotten. Almonds, sesame seeds, fish, eggs, any type of beans, broccoli, banana, any form of berries, mushrooms are considered as a superfood, and they work wonderfully for diabetes management, and they provide energy from a low calorie, and they provide minerals and vitamins. Now, the last slide which I will be talking about, which is very important, is a foot care. If you remember the comorbid conditions, the second point which I mentioned was diabetic foot and gangrene. This is not very common, but it is not rare. It mostly happens to people, the diabetic people. Either they are unaware of the symptoms and signs, they think doctor has prescribed them some pills and they are taking the medicine and they are okay. No. Along with medication, you should be looking after your lifestyle. You should be looking after your personal hygiene. Overall hygiene is very important, and you should be looking after any symptoms which are not the classical symptoms of diabetes. I have already mentioned few of them. Now, how it happens, like the foot care when we are talking about, there are more than 7,200 nerve endings at your foot. If you remember, I was just talking about crawling sensation and tingling sensation in your lower limbs. You'll find many people, they will say, doctor, I'm taking medicine regularly, my sugar levels are very good, but when I walk, I feel numb, my soul feel numb, as if I'm walking on a sponge. What is happening? This is just because the nerves are not working properly, means the nerves are getting affected. When the nerves are getting affected, means anything supplied by that nerve, mean the muscles, the ligaments, the vessels, the supply, the lymphatics, everything is disturbed. And when there is a disturb in lymphatics and vascular supply, then there is lack of nutrition going to the lower limbs, lack of oxygen going to the lower limbs, lack of drainage is happening. Whatever the debris are being produced in the lower limbs are being thrown back to the system through the lymphatics. the all debris collect in the lower limbs. You start having infections. The lower foot area starts dying. The cells start dying. They decay and form ulcers. And when these ulcer forms, even especially athlete foot, if the patient gets athlete foot, it's very much problematic because diabetic are tend to have super infection by bacteria or any other infections. So immediately that infection, and there is slow healing in diabetic patients. If you don't take care, it will lead to gangrene. Now, what to do? Always wash your feet with lukewarm water. If you have any of these things, even the simplest thing I can say, if you have profound sweating on the soles, then even the simplest thing which I said, profound sweating of the soles, wash your feet with lukewarm water daily. Trim your toenails and ingrowing nails because this will create ulcer with regular friction of there. Watch the calluses, corns. Don't cut yourself because if you are diabetic, suppose corns are like that, calluses are little bit elevated, but they are having a flat base. But corns are conical. If you cut the front, which you can see visibly, the cone inside starts decaying. It should be surgically removed by a surgeon. Don't do it yourself. Change your socks and stockings every day, especially if you are having more sweating in your foot or if you have an athlete foot. Keep your foot always dry. Don't walk barefoot. Many people say, even in ancient system, many people say, okay, walking barefoot on grass is very good for health. Definitely, it's good for health then because the nerve endings are activated and the circulation becomes very high. Okay, everything is good. But if you are diabetic, you should not be doing it because anything pricks your soul and you are diabetic, it will not heal fast. It will lead to complications. So be aware of that. Try avoid walking barefoot. Always use a proper fitted shoes. For making a style or anything, you should be first, do not compromise your fitting. The best fit you have, choose the style accordingly. So that's the end, but in the end, we will just recap whatever we spoke about. Like I said, diabetes is not only taking the pills. You have to strictly follow the lifestyle and strictly monitor your things which are going to happen, which are not good enough for complicating the things. Whether you are newly developing diabetes, whether you have diabetes, whether you have other complicated diseases, any other chronic diseases, you should be very careful. Now, the first rule for a diabetic patient or non-diabetic patient, have a regular checkup, especially if you have a family history, if you have a pre-hypertension, a pre-diabetes also. Pre-diabetes means if you have been labeled as diabetic, means you are diagnosed and you are on medication. Many people, I recently came across one patient, one gentleman, he was having very high diabetes and still he was not willing to take the medicines. Why? The impression was many of his colleagues were diabetic and taking medicine, but still they were struggling with diabetes. True, I don't disagree with that. I told that gentleman, it's very good that you are looking after alternative thing that you should be controlling your sugar levels. But you should be monitoring it regularly. Whether whatever the lifestyle management you are doing, is it working? If it is not working, you should be consulting the physician. It doesn't mean that you have to strictly take the medicine and follow the medicine. If you are being prescribed a medicine, you should be taking it. So what I told him, monitor your signs and symptoms. If you have these type of signs and symptoms, you should be very careful. Always monitor it. Taking pills is important. Doing lifestyle management is important. The same way is very important to monitor it closely. Now, what and when you should be monitoring? If you are diabetic, highly diabetic, if you are on insulin, you can monitor. Many insulin patients are monitoring their daily glucose level. Many do weekly. If you are diabetic on medication, oral medicine, fortnightly and monthly is good enough. Every 3 months, you should be doing your glycated hemoglobin, that is HbA1c, so that you come to know what exactly is happening. If you take a medicine and go for a sugar test, you may see the level has gone down. So you will be very happy. Okay, the medicine I'm taking is working very good. My sugar levels are very good controlled. No, it's that particular moment. You should insist for going every 3 months HbA1c, which will give you 3 months mean glucose, how much fluctuation it is happening. If you are on medication, you should be taking your medicine regularly and you should be consulting your physician. We came across many patients, they are diabetic, they are taking medicines. Since how long you're taking medicine? 2 years. When did you consult the doctor? 2 years back. Huh? You're not going to the doctor for a consultation. No, the doctor prescribed the medicine. And after taking medicine once or twice, I went to the doctor. He said it's fine. So now I'm buying the medicine from the pharmacy. It's not good. If you are diabetic, your doctor will be doing a comprehensive assessment and the lab panels every year or every 2 years according to your condition, because he has not only to see the glucose levels, he has to see your vital organs, whether your kidney is functioning properly, whether your liver is fine, whether your heart is fine. Are you developing anything extra which will be fatal for you? So let doctor decide and follow the instruction of the doctor. Avoid extra and simple sugar. Avoid caffeines, fruit juices. For a diabetic patient, we simply say eat a fruit, don't drink a fruit. As simple as that. Avoid tobacco in any format, whether it is oral, whether it is smoking, cigarettes, cigar, shisha, hookah, anything. Avoid alcohol. Many people think, okay, alcohol gives a pleasure and it is not affecting very hard, so I'll be using it. But alcohol also has a bad effect. It reduces the effect of the production and function of the pancreas, resulting in improper function of beta and alpha cells, which produce insulin and to regulate your glucose level. Avoid commercial food. Every time you have a choice, even if you go for a weekend, if you are going outside and eating outside in the weekend, always you have an option, healthy option. Choose wisely, enjoy. We are not saying don't enjoy. Don't entertain yourself on a weekend after a long hectic week. Do enjoy, but always opt for a healthy option. Do regular exercise. What exercise you should be doing? The cardio exercise and strength. Cardio exercise is very important in burning out your glucose, increasing your heart rate, improving the circulation throughout the body. Like we said, the peripheral neuropathy, peripheral vascular disease, the cardio exercise will help you. Simple cardio exercise, brisk walking, running, jogging, cycling, skipping. These are the common cardio exercises. Strength exercise. You can go for calisthenic, you can go for a lightweight training. Why strength exercise is also important in diabetes? Because you may recall many of the times I was talking about profound weakness, muscle wasting, the neurasthenia. Muscles lose their elasticity and functionality. To strengthen that muscle, you need some strength exercise also. Last not the least, manage your stress. Always have a proper sleep and do some stress management programs like meditation, breathing exercises. Have a good sleep. Sleep hygiene should be maintained. Thank you so much. If you have any questions, so I'll be happy to answer.
Good morning, sir.
All the questions will go through a central scheme. So please put your questions on the chat, and we will then pass this question on to Dr. Wilkhoo. Dr. Wilkhoo,
Sir.
I notice through your talk that you have been recommending balanced nutrition, vitamins, minerals et al., and also lifestyle alongside homeopathy. And this is in line with many of the previous speakers, allopathic physicians, who have in fact also been suggesting that lifestyle, nutrition, and exercise should complement the allopathic medicine. So that seems to be a common theme with all physicians. Now, Sujita asked the question, is it possible to use homeopathic medicines alongside allopathic medicines? We've been talking in terms of supporting the allopathic as well as the homeopathic regimens with lifestyle, nutrition, and exercise. The question is, in your opinion, is it compatible to use homeopathic medicines and also allopathic medicines in the same regimen?
Yes, sir. It's very much compatible for along with any type of medications the patient is having. Now, basically, I will divide homeopathy treatment for diabetes into three aspects where you can use very comfortably without any side effect along with the medication. First, if you are pre-diabetic and if you start developing some symptoms, if you don't want to go into a regular medication, then you can use homeopathy or any other alternative medicine to control it. Second part, if you have uncontrolled diabetes and if your sugar levels are not getting very much controlled by regular medicine, then you can take advantage of taking a support from homeopathic medicine, complement your regular treatment. It will not interfere with your regular medication, but it will definitely complement the diabetic management. And third, there are many things which I mentioned in the previous slides also. You are taking medication for your diabetes, your sugar is controlled, you are very happy, but you still have a lot of other complaints which you are not getting a solution. There, homeopathy works wonderfully to help you. So,
you spoke about chromium. You spoke about conium,
Sir,
and you said that it was helpful with the tingling sensation in the foot that is frequently felt by diabetics. The question raised here is by one of the participants who says, my mother is diabetic. She is on medicine and she feels a crawling, tingling sensation in her legs. My question here is, I would imagine, according to your presentation, that you may consider conium as one of the medications that you would prescribe. How does it work, Dr. Wilkhoo? How does it work? I mean, for example, would conium or any medication cure the tingling sensation? How do we improve the diabetic? How do we improve the health of the foot? In other words,
right,
through
sir.
I'm talking about through the medical aspects. It's true you've already mentioned exercise and keeping the foot clean and massage and walking and things like this. But is there any medicine? No, you're a vastly experienced physician, knowledgeable both in allopathy as well as in homeopathy. So, is there any medication, to your knowledge, that can be helpful in the curative aspect of this tingling sensation in the feet, in order to prevent later complications?
Yes, sir. It's a very good question. Generally, what we say during diabetes, if it is uncontrolled, the nerves and the vascular supply gets damaged. So when there is a damage process occurring, the nerves which are supplying to the end of the muscles, which are controlling the muscular elasticity as well as the vascularity, they start reducing their sensory effects. So these sensory effects actually are functioning to reduce the function of that particular muscle and area. In other words, the sensations are increased because it is not able to coordinate with the brain, because it is giving the sensation that these are the symptoms. All symptoms are produced in the body, whether I'm not talking about any pathy, any symptoms, sensory symptoms produced in the body are interpreted by the brain and act accordingly. The brain gives us order what to do. Now, when there is a sensory sensation, that means it indicates there is a vascular irregularity, that the muscles are wasting, the muscles are not having elasticity, and the drainage, which I mentioned, the muscle, the blood supply is going, nutrition is going, oxygen is going, but the waste material is not able to come back. It's being locked into the lower limb. The drainage system is not working properly. Then homeopathy works very good. The conium, what you mentioned, conium is one of the symptoms. I also mentioned homeopathy works according to individualized and totality of symptoms. Conium is one of the medicines. There are many other medicines. And second thing which I want to mention, many of the times when we talk about the modern medicine works on the evidence. Evidence means if you have high fever, so why there is a high fever, maybe there is an infection, and we'll treat the infection, the fever will come down. I'm just giving an example. Many times patients are suffering from many symptoms, many uncomfortable feelings, and they are trying to explain to the doctor, but doctor is not able to find anything. Here homeopathy works very good, because homeopathy works for symptoms narrated by the patients. The totality of symptoms is taken care of. So next question you can take.
Yeah, the next question is, Dr. Wilkhoo, you spoke a lot about the minerals, vitamins, and enzymes, etc. Uh, does diabetes, I'm sorry, does homeopathy per se have a medication or prescribed medication, a similar medication for general well-being?
Yes, sir. It can be used for general well-being, and supplements and minerals always. Either you can take it from your regular food or you can take it as a supplement. And always, the natural resources are best. You should be having a proper nutritious diet so that you don't lack of vitamins and minerals.
On two or three occasions during your presentation, you spoke about stress being relevant to diabetes. Uh, is there any homeopathic remedy that could be helpful for individuals who have stress and anxiety?
Yes, sir. Very true. There are many medicines which works on brain function to reduce anxiety. It's not a sedative. It's not a sedative. It's not a sleeping pill. It reduces the malfunction of the brain activity. When your brain becomes hyperactive, it reduces that activity. It's very good. Homeopathies have many medicines for that.
Well done, Dr. W. That was an answer well given. Uh, uh, there is a question that I believe answers itself, but nevertheless, I will present it to you. There was a young lady who was controlling her diabetes or had gestational diabetes during the period of her pregnancy. It seemed to have been well controlled. The question that she asks is, should I continue testing, etc., after my delivery?
Yes, sir. I think Nina has asked this question. Definitely, gestational diabetes. There are two aspects of gestational diabetes. One, the pregnant lady develops a diabetic means hyperglycemia during the pregnancy, and most of the times after delivery it goes off. But many of the times it remains. You require medicine, even if you don't require. Like I said, it goes off after the delivery. But since you had an episode of hyperglycemia during your pregnancy, you should be very careful. You should be monitoring. At least every 3 months, you should be doing your HbA1c so that you know, even if you're not medicated, if you're not diabetic, at least you should be doing it. If you don't have any symptoms for next 6 months, means every 3 months you are doing the HbA1c, you should always do an annual health checkup.
Dr. Wilkhoo, unfortunately, I have time only for one more question, and I'm going to ask you a difficult question, sir.
So,
Please use your discretion in answering this question.
so
Our allopathic colleagues prescribe medication along with for diabetes, along with lifestyle, diet, and all these other aspects. Now, you have earlier mentioned that homeopathy and allopathy are quite compatible together. And as a homeopathic physician, you have absolutely no you have no issue whatsoever in prescribing your homeopathic remedies and allowing the client or the patient to continue with his allopathic medicine. My question to you is, in homeopathic medicine, do you have, now I'm saying this in the context of the fact that in your presentation, you mentioned that homeopathy was a minimalistic type of discipline which used very low dose medication. You mentioned that it came from natural products such as minerals and plants and things like that. You mentioned the absolute almost non-existence of side effects. So my question to you is, keeping all these profound benefits that you have spoken about, would you be comfortable prescribing homeopathic medicines alone, along with lifestyle, exercise, and nutrition to your clients and patients with comfortable confidence that it is in their best interest or it is in their good interest? Is homeopathy good as a standalone system along with diet and exercise for individuals with diabetes? According to your opinion, sir.
Uh, it's a very good question. Many people ask this question. Definitely, homeopathy works wonderfully, individually treating any disease, even aside with any other medication. Homeopathy medicine, along with lifestyle medicine and lifestyle management, works wonderfully for all type of chronic disease. I'm not talking only about the diabetes. And that's the reason WHO, according to WHO, homeopathy ranks second in the world for all type of medicinal practices. Definitely, it works very good. It depends on patient's body acceptability. Even if you go say modern medicine, when you are taking so many medicines, the sugar level is not being controlled. It all becomes individualized. So
You should have been a diplomat because you answered this question and many other questions with a complete openness and acceptance. Well done. In an earlier answer, you had said that homeopathy works alongside allopathic medicine, which is an excellent answer. And in the last question, you said, but homeopathic can also work alone. And therefore, you stood by with great courage and fortitude for your discipline. You were willing to accept other disciplines, but you are not willing to disrespect your own. Congratulations, Dr. Wilkhoo. I thank you so much for your valuable presentation and answers.
thank you.
And now,
Sir.
ladies and gentlemen, it is my pleasure to present to you our next topic. Our next topic is diabetic neuropathy. Now, we've heard these words, retinopathy. We have one for kidney problems, and now the spectrum of neurology and neuropathy. And speaking in this webinar is our Director, Medical Services in the RAC Hospital, who is also a neurologist. So, ladies and gentlemen, I welcome you all on the 25th of November to our next session. I'd like to thank the participants. I'd like to thank, first of all, Dr. Wilkhoo for that enlightening session on alternative medicines, specifically homeopathy. I'd like to thank our audience for listening in and for coming in as frequently as they do for our various webinars. I would be remiss if I didn't thank our support systems, the IT department, Arabian Wellness, and RAC Hospital for making these facilities available. And thank you from my side. Good day, ladies and gentlemen. We will see you again on the 25th of November. Thank you and goodbye.